Hi all, today I will share my experience as nursing clinical instructor or clinical instructor of nursing. After finishing off my B.Sc nursing, I worked as a nursing clinical instructor in a very good nursing college of Kolkata. Everybody is thinking that nursing is very tough, too much pressure is there, no enjoyment is there, it's like that. But what I can say that yes, obviously there was pressure in my job, but I enjoyed a lot. And this almost like 2 years I worked as clinical instructor, so this experience only today I will share with you. So the first one, work schedule. In clinical instructor job role, the work schedule or duty time is most of the time is like 8 to 4. So in nursing colleges 8 to 4. So I used to start my journey from my home at 5:50 a.m. and I used to reach there before 8. I used to get dressed and be ready and was used to go to word, means in which area my students were posted. Yes, in clinical instructor role we have to supervise the nursing students when they are going to clinicals. So this is the exactly role clinical instructor has to perform. So in my this 8 to 4 duty schedule, I used to stay with my students from 8 a.m. to 1:30 p.m. Then we used to come back to college and have lunch, and then all the other works are there, like for 2 to 4 maybe little bit of lab sessions, 1 hour or 2 hour of lab sessions, or 1 hour or 2 hour of practical classes. Then by 4 we used to go home. So this is all about my duty hours or work schedule. Next one, I will talk about learning scope. Obviously I learned a lot because I used to go with my students to a clinical area for their clinical exposure. Now obviously they were learning, I was also learning, because I was helping them to learn, I was helping them to learn about new things from the hospitals, and that time I was also gathering various experiences about the rules, protocols of that particular hospitals. So like that way, seriously I gathered a lot of skill and knowledges as clinical instructor. Next one, if I will say, like obviously if anybody will work as staff nurse or something like that and there is too much pressure, they will not get that much of time to go for their tea break, to go for their lunch, like that. But what I can say that as clinical instructor we were able to go for these tea breaks or lunch. Obviously there is too much pressure or there is too much assignments or something like that, that time also we also faced problem, but other time we are able to take it on time, these tea breaks and lunch. Next one, student teacher relationship. Obviously it's like for me, I can say that when first I became as clinical instructor, that time I was also excited and getting fear that how it will be my relationship with my students. So obviously first few days it was not that much good, but later it was really very good. My students loved me a lot, I loved them a lot, and not only that, our relation became very smooth, that when there is any type of bad situation, no, I used to tell them, no, okay, in front of this person, no, I may scold you, but please don't mind, because you know that you have not done any wrong thing, but as to control the situation I will say these things to you. So like that way only I used to handle the situations. And obviously my relation with most of the students, I will not say all students, because it's not possible that every teacher will be good for every student. The teacher will be bad for some students also sometimes, isn't it? So my relationship with my students most of the times, for most of the students, were really very good. The next thing I will talk about other responsibilities as clinical instructor. Like there was, we used to go for these labs or practical sessions or examinations, or not only that, the students have various types of assignments in Word that we have to complete. We have to take the presentation, we have to help them at the time of these lab sessions, examinations and all those. So other works are also there, but it's actually fine. And what I remember, I was this in charge of anatomy lab, and I used to go for these practical classes of these anatomy sessions for the nursing students. And we are saying that there is no enjoyment in nursing, but I enjoyed a lot this my clinical instructor duty time period with my students. There was picnic, there was sports, so obviously I enjoyed this time with my students and my colleagues a lot. I cherish those days. And my last day there, obviously, as I used to travel from my home to my workplace, and it's really very far, so after a certain time I thought that I should resign from that place, because now it's not happening. It's I'm not that much capable to go every day there and come back, so I have given my resignation. And the last day, seriously, my students were also crying. I felt like very bad. I also felt like crying, but in front of them I didn't cry. But seriously, it's very good time for me as a clinical instructor in those nursing colleges. And when now I'm remembering, no, I'm feeling really very good, because I have connections with my those old colleagues. I have connections with my those old students. So it's really very great actually for me. This clinical instructor job of nursing is really very good for me. So this is all about this role of clinical instructor. Thank you for watching the video.